Count Corla. Taoiseach, there's an ongoing crisis in our mental health service for children and young adults. There are 3,900 young people on waiting lists, up by 40% in the last year. You would imagine that for the HSE this would mean an urgent response to increased services, but quite incredibly, the HSE has announced an actual cut in services with the closure of almost half the beds in Lindara facility in Cherry Orchard. Lindara is a key facility for children and adolescent mental health services nationally and for the greater Dublin area, Wicklow, Kildare, Louth in particular. The HSE has said these bed closures, a reduction of 11 beds down from 24 to 13, is a consequence of shortages of qualified staff. The CAMHS unit in Cherry Orchard should have 51 nurses, it only has 24. There's an ongoing problem of recruitment and retention in the health service as a whole. We've heard from the medical scientists and retention, and the PNA, the Psychiatric Nurse Association, have described the bed closures at Lindara as a consequence of poor planning by the HSE. The PNA pointed out that similar closures took place 5 years ago in 2017, but it seems nothing has been learned since then. Mental Health Reform, a national coalition of groups concerned with mental health issues and services, have called for the reinstatement of a National Director for Mental Health to report directly to Paul Reid, the HSE CEO. They say this post is essential to ensure proper oversight and leadership in the improvement of mental health services nationally. In 2006, Taoiseach, Vision for Change was adopted as a government policy to transform these services. Vision for Change called for 100 beds to be available. We now have just 56 beds nationally following closures of in Cherry Orchard. Mental health reform has also pointed out these reductions in beds could mean children may end up being admitted to an adult unit for mental health treatment, which would be in contravention to their human rights. It will mean that young people will face increasing difficulties in accessing care in a situation where long delays can have a devastating effect on families and children in need of early intervention. What has happened makes a mockery of sharing the vision that followed Vision for Change. There's a need for urgent action. The reduction in beds and overall service at a time of an escalating crisis is simply unacceptable. What action do you propose to take, Taoiseach? It's not good enough to say there's a problem with recruitment and retention. The situation requires urgent action.
Thank you. Taoiseach. Thank you, Deputy, for raising this very important issue, and it is a serious issue in terms of CAMHS inpatient bed capacity, and particularly the decision in relation to Lindara and the reduction of beds there due to a range of issues, as the Deputy has said. And at the first instance, I want to say that the Minister, Mary Butler, is working with the HSE intensively to make sure that this is a temporary situation and to get this reversed. As you said, there's a number of beds are not now operational in Lindara. The same applies to Merlin Park for different reasons. And 10 of 12 beds are operational in St. Joseph's, and the full 16 beds in Aisling are fully operational. In relation to Lindara, the regrettable situation has come about because a number of nursing posts have become vacant simultaneously for various reasons. It's not a resources or a funding issue, but a staffing recruitment issue. The nursing complement available through the use of permanent and agency staff is no longer sufficient to continue to provide a full 24-bed inpatient service to a safe standard. That was the basis and the rationale for the decision taken. 7 beds still at Lindara are there, and they're specific for eating disorders. No young person was discharged early from the unit as a result of the reduced bed numbers. In terms of Merlin Park and St. Joseph's, St. Merlin Park is due to reconfiguration of 2 shared bedrooms to single rooms because of COVID, nursing staff vacancies and physical risks associated in some rooms. The 2-bedroom reduction in St. Joseph's is due to staff vacancies and again physical limitations of the unit there as advised by a consultant psychiatrist. The HSE have and did explore all options prior to making this decision. So, for example, looked at redeploying staff from other CAMHS units or teams, weren't in a position to do that, and they didn't want to impact negatively on CAMHS community care and the CAMHS community teams, which is a a key part, obviously, of the broader CAMHS programme. All 4 CAMHS units nationally will work collaboratively to maximise the use of national CAMHS bed capacity over the coming while. And the Minister and the HSE will work to intensify efforts to recruit the specialist skills and people for the vacancies that are currently there. To the end of March of 2022, there has not been any admissions of under 18s to adult facilities. And in 2021, there were 25 such admissions, down from 50 in 2019. And again, that's something that we do not want to see happening within our mental health services, and particularly in relation to young people. And just to say that 91% of urgent CAM referrals are now seen within 48 hours. The funding is there. Record funding has been provided for CAMHS, over 1.149 billion, significantly up again on last year, but it is an issue of recruiting specialists and staff.
I'm going to repeat, there are 3,900 young people on waiting lists, up by 40% in the last year. COVID-19 has impacted a lot of young people's mental health and adults over the last 2 years. And that to see the HSE cutting beds rather than maintaining the beds is just absolutely incredible. Now, the situation, you were saying there that you have been looking at the HSE of bringing in teams from other areas. But the question is that if any children have to go to an adult care, it will be breaking their human rights. They should be cared for within CAMHS. So, Taoiseach, I don't think it's good enough to stand up and say what you just said there. This should have been well planned for. The Minister for Mental Health and Older People launched sharing the vision, the implementation. That should have been well flagged up if there was a problem. It should have been addressed a long time ago. We were looking at 6 months, 8 months ago that we're having problems with staffing in the area. This happened in 2017, Minister or Taoiseach. This has to be resolved and resolved immediately.
What I would say to you there, it does have to be resolved, but also the level of service is expanding all the time as well. But then the level of referrals is going up exponentially also. And yes, COVID had an impact, without question. And COVID has actually had an impact on the number of young people contacting their primary care services, contacting community teams in respect of mental health issues arising out of COVID-19 also. And that's a feature across the health service in the last 12 months, certainly in the last 6 months as we emerge from the emergency phase of the pandemic. There's been an exponential growth in activity and in referrals, which is exacerbating the problems and the issues we have. And the funding has been provided to recruit as many people as we possibly can in all of the different disciplines, and that will continue. In the meantime, the Minister will work with the HSE to see what we can do, particularly in relation to Ling Dara, because there is an urgency attached to that, and I thank you for raising it.
Thank you very much.